I'm Ryan Bunyon. I'm the inpatient APD for hospitalist medicine.
So I'm Eliana Hempel. I'm the Ambulatory Associate Program Director.
Hi, I'm Alia Chisty. I'm the new Program Director for the Penn State Internal Medicine Residency Program.
Hi, I'm Tinsley. I'm the Associate Program Director for Research and Scholarly Activity.
There's something very unique about Penn State. We have almost every single post-internal medicine fellowship training program available at our institution. We have a lot of exciting research happening in every division. We have a lot of exposure and a lot of opportunities for residents who come here to learn.
They've got a chance to come to a place that, again, outside of the hospital is really nice to sort of live and work with tremendously nice people, and a lot of the barriers that sometimes are placed in other programs, you know, they don't exist here. And so you can, if you really want, you can do great things here.
People told me that Hershey is the sweetest place on earth. And I always say this because it's true. It was the thing that I noticed most when I interviewed here for my own faculty position. People are so thoughtful, so kind, so considerate. This place generates a feeling of family, of collegiality, of teamwork, of kindness, and of empathy. And I think you want to work someplace, you want to come to work every day because you know your colleagues are kind. And you know that the kind of care that's getting provided every single day to the patients is coming truly from the heart. And I can't think of a better place or a better way to feel joy in the job that I do than to be in a place like Penn State.
Our residents get to see a really wide breadth of pathology, and they get exposure to kind of every different bread and butter condition, to the zebras as well.
I think you come here because you're looking for a desire to change the entire medical system for the better. You know, we focus a lot on systems training and systems thinking and improvement within the entire medical system. And if you're looking to make medical care better in America, I think this is an institution that would help you deliver on that goal.
Having gone through our program, I can personally attest to the quality of education that the residents receive here. But not only that, I think working with faculty and with a department that really prioritizes education very highly is not something that you find at every institution. And so I think having an opportunity to stay on faculty has been a really great experience for me. And I've continued to watch the Penn State health system just grow in a really positive way.
When you round with me, we're doing bedside rounding, and I get to see you function as a complete working physician. So instead of just reading to me at a table in some closed off room far away from where the care is actually happening, we go to the patient's bedside, we incorporate the patient into the plan, and I get to see you translate that into patient-centered language. We get to see you incorporate the patient's desires and feedback about the plan into the plan, you know, reintroduce it and remold it as we're actually talking. And that's what actual physician work is. And so when you round with me, that's the type of training that you're getting, is me giving you feedback on being an actual physician.
And so I love to get to know the residents as who they are, but then I also want to know how I can help you to be better and successful in the way that you want to be in your own personal growth throughout the course of residency program. And I will work with you, we'll try and get you the resources that you need, we'll individualize your growth during residency so that you're able to graduate to do whatever it is that you want to do once you graduate from here.
There'll be a lot of one-on-one attention along the way and mentoring to make sure that, again, everybody gets what they need.
I think one of the things I love most about them is that they prioritize patient care over everything else, which allows them to develop really strong relationships with their patients, both in the inpatient and outpatient setting.
So you see our residents when they graduate being able to really navigate the entire spectrum of care, from outpatient through the complications, you know, into a hospitalization and back out again.
Their willingness to meet the patients where they are and really put their patients' needs first is fantastic and a lot of fun to watch as a faculty member.